Welcome to Hudson Health. My name is Dr. E.J. Akunyili. I am Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health. So I'm here today with our wonderful guest, Dr. Safoaah, who will be telling us about all things diabetes, weight loss, mental health. We do know how important primary care doctors are, not just for our community, but for the health and longevity of this community. And we've also heard a lot in the news about the scourge of obesity and diabetes in the United States, and how in many ways these are diseases that lead to other diseases. So very excited to have Dr. Safoaah. She's a wealth of knowledge. She is part of our extensive primary care network here in the medical center in Jersey City. We've always been passionate about having practitioners that could serve the community, but practitioners that look at health holistically. So not looking just at the individual as a constellation of symptoms and illnesses, but as a whole person. So I am beyond excited to talk to Dr. Safoaah today. You will find her to be a wealth of knowledge. We will discuss diabetes, medications, treatments, individual tailoring, weight loss and weight management has been in the news. Everything from Ozempic, which is now a household name, to non-medicinal surgical treatments for weight loss. And then mental health, something that affects all of us, and how do we incorporate that in the primary care setting. So we'll be right back. Excited to talk to Dr. Safoaah.
Comprehensive healthcare is here, here, and here. RWJBarnabas Health is healing, enhancing, and investing in Hudson County with its two newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Welcome back to Hudson Health. My name is Dr. E.J. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health. Today, I am absolutely excited to have with me Dr. Safoaah, an internal medicine doctor with RWJBarnabas Medical Center. Really excited to have you. Welcome.
Thank you.
Tell us about yourself. Just introduce yourself.
Thank you. As you said, my name is Dr. Safoaah. I currently practice at one of the JCMC offices on 317 Central Avenue as a primary care physician. I graduated medical school from Ross University, did my internal medicine residency at Newark, Beth Israel. Currently practicing at my office, as I said before.
So excited to have you with us here in Jersey City.
Thank you for having me.
We're going to talk a lot today. One of the bread and butter for primary care doctors is diabetes. So I just want you to tell me about latest developments in diabetes management. Everybody knows somebody who's either diabetic or pre-diabetic. So please tell us, what are the latest developments and what do we need to know at home?
Thank you for the question. So you are right. Based on research and technology, there has been more advancement in the treatment and management of patients with diabetes. For instance, the introduction of the insulin pumps, where patients do not need to inject themselves on a regular basis. They insert a pump somewhere around the abdomen where it delivers insulin for them on a regular basis based on their blood sugar levels. There has also been a continuous glucose monitor involvement as well, where it calculates and records the patient's blood glucose onto their phones. And with that being said, it assists these patients to know which type of food, the kind of food to eat to decrease spikes in their blood sugars. And also there has been involvement in the medications we use in treating patients, different types of medications, how they have to take it in terms of a daily basis, a weekly basis, and it gives options, variety of options for patients based on their needs, their wants, and their likes.
This is fascinating. You know, I'm an emergency room doctor, so just to hear this innovations and the great array of options available to patients is great.
Yeah.
How do you choose? It sounds like you have to tailor it individually to each patient. So how do you make the decision what works for one patient versus the other?
So as I said, initially you have to know if the patient has any knowledge about their diagnosis. Some patients come in not even knowing they have diabetes. So if they come in, you screen them and you find they have diabetes. Based on their initial A1C, you can determine whether the patient needs to start straight from insulin or if they can do oral medications. If the patient also desire not to inject themselves at all, because some people are very scared of injecting themselves, there are oral medication options. If they are willing to inject themselves and they accept it, you can do these new incretins, which they inject themselves once a week. If these patients, depending on the type of diabetes they have, if it's type 1, they definitely need to start insulin. And if it's type 2, then we can do insulin depending on how high their A1C are.
That's great. There's so much interest in diabetes medicines, obviously, because there is an intersection very popular in the press between type 2 diabetes medicines or weight loss medicines or GLP-1s. So just tell us about different kinds of medication. You know, people out there saying, so which one should I be on if I'm on type 2? Should I take one that makes me lose weight? We'll talk about weight loss later, but I want to talk about diabetes medications.
Yes. So there is different types. For instance, our popularly known medication, metformin, which helps with decreasing the amount of sugar we absorb from the food we eat. It also prevents the liver from producing new glucose. There is also the SGLT2s that prevent absorption of glucose in the kidneys. We also have other classes that help with increasing your satiety, meaning it makes you full quickly. It decreases your gastric emptying, that makes you feel full for a very long time. And it also increases your insulin secretion to help with balancing your blood glucose. So when the patient comes in based on their comorbidities, some people come in with diabetes, with complicated by kidney problems. Other comes in with diabetes and they already have heart issues. So when these things, if they have other complicated comorbidities, then you choose their medication based on them. Especially patients with kidney problems do very well with the SGLTs, as well as people with heart problems also do well with the SGLT. It has been known to reduce their morbidity and mortality from cardiovascular events.
So this is really fascinating, very tailored medicine. First of all, make sure the patient can be compliant.
That's
right.
So
if people don't like needles, you get to know that first. And if they can be compliant, then you look at their risk factors and other problems they have.
Correct.
That's great. Well, we look forward to coming back because we have much more to learn about diabetes. I want to ask you more about lifestyle, exercise, diet. So please stay tuned. We'll be right back with Dr. Safoaah.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJBarnabas Health. Let's be healthy together.
Welcome back to Hudson Health. My name is Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, facility of RWJBarnabas Health. And I have with me our internal medicine Dr. Safoaah. Welcome back.
Thank you.
So we left off last time talking about diabetes, different medications. But let's pivot a little bit. Lifestyle. Is there still a role for lifestyle and exercise and diet? So it's just this complex question, but you can perhaps break it apart for us like you do for your patients.
Sure. So thank you for the question. The number one or the go-to treatment for diabetes is always lifestyle modification. And that's the first thing I always discuss with my patient, because if diabetes is usually due to the type of food we are eating and our body not being able to respond appropriately. So lifestyle become a key in treating diabetes. First of all, diabetes is due to high glucose levels in our blood. So if you are able to decrease the amount of glucose you put in the body, it helps the body to deal with the other nutrients that you consume. In the sense that eating high glucose dense food such as our carbohydrates, starch, rice, potatoes, our bread, our pasta, if you eat them so much, then you overwhelm the body from not being able to digest them and use the energy that it produces, and it just linger around in the blood. Exercising being the other tool for weight loss and treating diabetes Some study shows that when you exercise, even just walking, can help your body pick up these leftover glucose that hinder around in your blood and utilize them during this exercise hours. And it has been recommended to do at least 150 minutes of exercising in a week. So as little as 30 minutes for 5 days is enough for the body to keep active and also to be able to rejuvenate itself.
And it's so important. We've talked about it in the show. I think exercise gets a bad rap in the population because people think when you say exercise, they should run the Jersey City Marathon, which is great.
That's right. If your body can tolerate it.
But exercise is just getting moving, whatever you can do, right? Dancing, walking, swimming, whatever it is.
Right. So I usually advise my patient, especially the elderly ones that have like joint aches that keeps them away from being active. You don't have to go outside to exercise. You can easily walk to your kitchen if it's doable for you. I encourage them to take a little walks around their TV stands, to do a little walk to the bathroom. At least make it up to yourself to do this as many as possible, that it becomes challenging for the body. If you do something every day, the body gets used to it and it adapts to it. So every day, I encourage them, challenge yourself, do something different. Meaning, if you're able to walk to the bathroom for 5 seconds, try to do it every 5 seconds for 10 times. Then it becomes more than 5 seconds. Then the body will start making energy to burn energy, in a sense that it becomes another type of exercise for the body. You don't always have to go outside to run or jog. Even in your couch, you can do a little sit-up. You get up, you sit, get up and sit. That's another form of challenge for the body.
You'll be very proud of me. I started taking the stairs at work, right?
That's right.
Taking 3 sets of stairs when I have a meeting rather than taking the elevator.
That's correct. I remember in college, they used to have in the elevator, burn calories than using it says burn calories by going up the stairs and not using the elevator,
Every little step counts.
Counts.
Literally. So tell me, for lay people at home who do not have diabetes, or who have diabetes, or who may have been told they have pre-diabetes, it's really easy to check your blood glucose. Like you can go to any pharmacy and get the kits. How often should people be checking if they don't have a pump or one of those continuous monitors?
So depending on the severity of their disease, if let's say you have pre-diabetes, I usually don't encourage like glucose monitoring. I just tell my patients to do the right thing for themselves. And I made them aware that their risk of getting diabetes is high. And if you have diabetes and it's a type 1 diabetes, then we have to monitor, because you need insulin. We have to monitor on different times of the day to see how your blood sugars are going. And it depends on the type of food you eat. I usually recommend at least checking your sugar once early in the morning before you eat anything, or 2 hours after your heavy meal.
So real quick, before we get off this segment on diabetes, what are the long-term complications of diabetes? Obviously, your job is to have patients avoid those complications. But if untreated, if people are not seeing their primary care doctors, what are the complications they could develop?
So diabetes, as we all know, is a silent killer. It deposits these heavy extra glucose into our cells. It can damage the eye, can cause glaucoma. It can damage the back of our eyes, causing retinopathies. It can deposit into our blood vessels, leading to heart attacks, strokes. It can cause nerve damage, causing permanent pain, tingling, numbness in our feet. And that's one of the biggest complications that patients have. And it's not curable. When the nerves are damaged, you can only control the pain, but you can never treat it.
On that note, that's precautionary tale to please see your primary care doctor. And of course, we do want to keep this community healthy and get diabetes under check. Thank you. We'll be right back.
Thank you.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net, at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. My name is Dr. AJ Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health. Back again with Dr. Nana Safoaah. So many questions from the last segment. So we talked a lot about diabetes. And during the break, I got some questions which I have to ask you. I don't think we talked about symptoms of diabetes. We just jumped into treatment. So how does somebody suspect, if they're not getting regular blood work, that they have diabetes?
Thank you for the question. So diabetes, as we said, it's a silent killer. So it's very hard to tell when you're having diabetes. But there are some peculiar symptoms that can guide you or awaken you to thinking of checking for diabetes. One, drinking so much water than usual. It makes you very thirsty because it keeps your blood very thick and keeps you very dehydrated. You're peeing more than usual. Due to the high concentration of sugars in your blood, your urine tends to be very concentrated. So you start peeing a lot and you start drinking a lot. You start eating a lot, but you're not gaining weight because the body is not using the glucose that it's producing. Instead, it's breaking down your fat, your muscles, and then patients are eating so much, but they're not gaining weight. Instead, they start losing weight. These are some of the symptoms of diabetes. It's called polydipsia, polyphagia, and polyuria. These are the 3 Ps for diagnosing diabetes, including the level of your blood sugar levels.
Well said. I do remember that mnemonic in medical school. That's good. Now, a lot of people have wearables, so Fitbits, Apple Watches, different types of wearables. We're not endorsing any one of them. How does that help as we talk of lifestyle management, exercise, movement?
So it's a very good item to have with you because these watches keep track of your steps, and it encourages patients to do the right thing in terms of exercising. It checks your heart rate and it can tell you how fast your heart is going. And if you're not tolerating that level of heart rate, you can calm down or slow down whatever you are doing. It also tells you how many steps you've taken on a daily basis. You can track. You can share your activities with friends, and it keeps you encouraged in groups. Whenever you have your circles, especially with the iPhone, when you have your circle add up, you feel very accomplished, and it always want you to do more. When you have like the Samsung watch, it also gives you like a sneakers at the end of your target activities, and it always makes you feel very accomplished as well. It's the accomplishment you feel from having these activities telling you you've set your goals. You've reached your goals, and you are able to set goals with them as well, like how many steps you want to take in a day. Whenever you sit for so long, it reminds you of, you've sat for a very long time. You should get up and do a little walk around. And it also acknowledges your effort, which I think is very helpful as well.
Absolutely. I do like the reminders to get up from my office and walk around. So while we're talking about steps, let's talk about weight loss. I know part of what you do as a primary care doctor is advise people treat obesity. So what are the long-term effective weight loss strategies, and what are you hearing, and what are you telling your patients?
So I always tell my patient to set realistic goals in the sense that you cannot want to lose 10 pounds in a week. It's very unrealistic and non-sustainable.
And if you see an ad for that, it's probably fake news, right?
Right. Because to have a healthy weight loss is the key, not just losing weight. I know we can easily do certain changes in a particular time to lose a significant amount of weight, but you easily gain it back because it's non-sustainable. So I always advise them to have realistic goals, to be very disciplined with whatever they are doing, and also be consistent. Those are the key things to having a successful weight loss and being able to maintain them.
So some of us that have been around for a while have seen sort of the metamorphosis of different weight losses, whether it's high protein, low carb, high fat, name it, multiple of the commercial weight losses, a combination of all of this, Mediterranean, different ones, and they're all packaged, but in it's those same themes.
Mm-hmm.
based on the literature, is there any objective evidence one works versus the other, or do you just encourage healthy
So for
eating?
all the weight loss diet options that we have in the market, I usually encourage my patients to do the Mediterranean diet, which has more research on it. And I feel the type of food groups that are advertised in those type of diet is much more realistic to the human life. Low carbohydrate diet is also a good option for patients that have diabetes. The DASH diet, which is, I think, dietary approach to stop hypertension, is also another option, and it helps other patients with hypertension. We also have the high protein diet, and I think protein is a very essential part of our human nutritional needs, and it keeps us full for a very long time. And I encourage patients to eat more protein as well. In terms of the fat diets we have in the market, most of them are very unrealistic for us humans, and it takes away the natural resources, the natural food that we need to eat. And it also does not give a sustainable weight loss. I mean, if you eat and some of them are also not good for certain type of patients, especially going on a high fat diet in a patient that has family history of hypercholesterol and all that stuff. It becomes very unhealthy for them.
We'll be right back. This is fascinating, and thank you for the evidence-based overview of all the diets. It's just always one in the market, but it's different things packaged. We'll be right back. We'll talk some more about weight loss and mental health.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Welcome back to Hudson Health. My name is Dr. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center. And I have with me Dr. Safoaah. How are you? Welcome back.
Thank you.
So we went on break, and this is such a fascinating topic because we go on break and we get all those questions.
Right.
So before we go to mental health, let's just stay a little bit with weight loss. So many weight loss medications on the market. We know they're all trademarked, so we don't have to name them all. But
That's right.
how are you seeing this in your practice? Are you recommending them as first line, second line? Are you recommending using them for perpetuity or for a short period of time?
Okay. Thank you. So when it comes to weight loss medications, I always advise my patient to try to do their best first. So because these medications I feel like they are a kickstart to your weight loss journey than being the sole goal for weight loss. A lot of people just take the medications and expect to lose weight. But these medications, you have to add good eating habits, exercising to be able to achieve your goals. So I always tell them, and you have to start somewhere before the medication can come in. So some people actually do well on their own and they do not even ask for the medication anymore. Other people that it becomes very hard for them to lose the weight, I encourage them to do it for a period of time and you wean yourself off. And when using that period of time when you're on the medication is for you to learn the good habits, because we've been eating the same food since childhood and it becomes very hard to make adjustment just like that. So while you're on the medication, you see some changes in your life and you become excited and you want to keep up with that habit. That's when this medication helps. But if you solely depend on them, I don't think it's healthy, because these medications have side effects that are not good for the body as well.
That's great. So let's talk a little bit about stress management, right? Part of obesity or being overweight is the stresses of daily life. How do you incorporate any coaching about stress management in your primary care appointments?
Yes, I do. Thank you for that question. I really encourage my patient and always screen my patient for stress. Sometimes we individuals don't even know when we are stressed out. We can't even pinpoint where our limits are, and we keep pushing. So whenever my patients come in, their facial expression, their concern, sometimes you are stressed out and you might be feeling aches and pains, uneasiness, anxiety. All these things come in just from being stressed out, and you're not able to tell. So if I screen my patients, and when they are able to tell me, sometimes they're not able to tell you because they don't know. But you point things to them. You tell them things that could be stressing them out. Like if there's a new job, you might not know how stressful you are because you're excited to go into the job, but you don't know what to expect. Those things can stress you out without even knowing. I encourage my patients to voice out, get involved in activities that they love to do, like listening to music, cooking, hanging out with friends, going for walks, doing activities. Some people are very good at writing novels and stuff. I encourage them to do things that they actually love and bring them joy. And these things help break down your stress to some extent.
So just activities of daily life that they find personally enjoyable away from the stresses.
That's correct.
So how do you, as we segue to the broader theme of mental health, right? So we do have psychiatrists, we have therapists, we have various mental health workers, but most people will come to their primary care doctor as a first stop shop. So how do you screen for depression, anxiety, or the mental health problems when you see patients?
So on an annual basis, we do this screening for depression, anxiety, and we have questionnaires that we ask our patients to answer. And based on how they score on these questionnaires, we are able to tell whether they need help or assistance. Some patients might deny help because they don't, there has been a lot of stigma to psychological issues, and it makes a lot of people not wanting to seek for help. So when they answer these questionnaires, you find ways and means to encourage these patients to see other specialists. Some patients might all do well with just having a behavioral therapist to talk with, to voice out their needs to them, whatever they are going on with them. Others might need medication to assist them. So when that happens, then they will be referred to a psychiatrist who will guide them into the appropriate therapies that they need in terms of medications.
Absolutely. You are right about the stigma associated with mental health. And the great thing about our network is that we have a wide variety of mental health experts, all the way from therapists to psychiatrists. And one last thing before we go, I know that there's been very little, at least when I trained, we didn't really talk about sleep.
Right.
But the literature on sleep is robust. It's getting better. What advice do you give your patients about sleep and rest in relation to overall health and mental health in particular?
Oh, thank you. So sleep is a vital thing for the human body. When you have adequate sleep, it improves your mental, your social, and your physical health. I encourage my patients to have good sleep, especially those that have medical conditions, even everybody. Because, and when it comes to weight loss, having a good sleep helps because there's this hormone, study shows that the leptin hormone that controls your hunger and keeping you full is usually produced at higher amounts at night when you have a good night's sleep. So when you do that, you end up feeling much more satisfied, physically fit to go about your daily activities with no restraints. And also, you stay healthy with that. It helps rejuvenate your brain cells and other cells in the body as well.
Well, Dr. Safoaah, what a pleasure to talk to you. Thank you. We definitely have to bring you back. Lots to talk about, all things primary care,